Dr. Cohen, let's talk brushing teeth a little bit, especially brushing teeth if and when the braces are on, but even perhaps brushing teeth just in general for people. Despite the fact that it is apparently the most simple thing, the truth is some people say up and down, left and right, some people say circular, and definitely shed some light on of what people could and should do if and when braces are involved.
Very definitely a circular motion is important. Really the biggest thing that we find with people that have difficulty in brushing are two things. Number one, they don't spend enough time. Brushing is something that should take you anywhere from 2 to 3 minutes at a time when you brush. Very few of us actually will do that unless we're educated to do that. You just can't brush everything in 25 or 30 seconds and actually get things cleaned at the same time.
Oh, I am educated. My wife has educated me. I'm still not doing it.
Well, maybe you're not educatable. Who knows, right?
Yeah.
The other thing is that there are a lot of electronic type toothbrushes that are available, Oral-B, Sonicare, and for some people, the ability to have something mechanical to help them really kind of helps them be a lot better at their toothbrushing. So.
And they can be, those, sorry to interrupt you, those mechanical ones, the Oral-B and all those things, they can be used if and when braces are present also?
Absolutely. And a lot of the research says that we actually get a better chance of complete cleaning if we use a mechanical toothbrush along with, daily brushing the way it's supposed to be.
Interesting. Now, what about flossing? When I, for instance, floss, I seem to be pressing relatively hard towards the gum or down, up or down. Is that a good way to do or not so good way to do? Am I basically irritating and massaging the gums too much or
you're definitely correct as far as your up and down motion. You definitely don't want to saw it. That's not what floss is for.
Well, actually, I think I do sawing. I go like this inside my gum. That's not good.
Really, it's really more of a vertical thing, straight up and down. Kind of wrap it around the tooth and go straight up and down. The sawing motion can irritate things and can actually start wearing grooves within the roots of the teeth themselves. Flossing with braces on is just as important, if not more important, than flossing without it. It's one of the most difficult things that we have people do, whether they have braces or not. Flossing is not one of those things that's automatically done, but it does make a huge difference in the health of the bacteria elimination between the teeth. You just can't get to those places with toothbrushes. Flossing is something that, if everybody did, we'd have even less cavities than what we have now.
And less gum disease. Tell me, I lived a couple of years in India, something like 15 years ago, and literally everybody I know at least they used a tongue scraper. Now, ever since, I haven't really used a tongue scraper, but ever since I brushed my tongue and my things with the toothbrush. Do you have some comments on that?
The tongue is a big sponge, and it very definitely withholds a lot of bacteria and even yeast. There's all kinds of different things that live within the mouth. By tongue scraping and brushing the tongue, it helps eliminate some of that. Helps really more with bad breath than it does anything else. But anything you can do to eliminate as much bacteria from the oral cavity as possible helps make everything much healthier. The gums, the teeth, less cavities, less gum disease, and a nicer smell too.
Well, that's good. That's a good thing. So it is a good thing to use a tongue brush or tongue cleaner or a brush at least. So it is a good thing to do.
Absolutely.
All right. Thank you very much, Dr. Cohen.
Thank you.